How do drugs work? The basics of drug receptors. Broadly speaking, there's three ways drugs work. By modulation of voltage-gated ion channels, i.e. calcium channel blockers, anticonvulsants, local anesthetics. Receptor modulation, and there's four different subtypes which we'll discuss. And enzymatic modulation, aspirin and COX inhibitors. Broadly speaking, the four types of receptor are ligand-gated, G-protein coupled, tyrosine kinase, and intracellular. They can be either on the cell membrane or inside the cell, and based on how they work, their speed and duration can last from a few milliseconds for ligand-gated ion channels to hours for intracellular receptors, which rely on changes in DNA production and protein production to have an effect. The examples include nicotinic acetylcholine receptors, muscarinic acetylcholine receptors, insulin and steroids, for ligand-gated G-protein coupled, tyrosine kinase, intracellular receptors, respectively. G-protein coupled receptors are an essential receptor. They are also known as serpentine receptors. They have 7 transmembrane spanning domains. Outside the cell, they have a ligand binding site. Inside the cell, have alpha, beta, gamma domains. The alpha domain has GDP bound in the inactive state. Once the receptor is activated, the GDP is converted to GDP. So ligand binds conformational change of receptor, activation of GDP to GDP of the alpha subunit. This causes both the alpha, beta and gamma subunits to dissociate, the alpha one alone, and activates either an enzyme adenyl cyclase, which converts ATP to cyclic AMP, or the membrane enzyme phospholipase C, causing lipid breakdown PIP2 to IP3, which increases cyclic levels of calcium, and also, in addition to the formation of IP3, you get DAG formation, which activates protein kinase C. These pathways don't last forever, and they're intermittently activated and deactivated, and in order for the deactivation process, the alpha subunit has a GDPase, which converts GTP to GDP, therefore inactivating the process. Broadly speaking, G-protein coupled receptors has 3 subtypes. GI, so binding of the ligand to the receptor, causes inhibition of adenyl cyclase and therefore reduces levels of cyclic AMP. GS causes the converse, so activation of adenyl cyclase on binding of the ligand, and conversely GQ, which activates phospholipase C, enhancing the levels of both IP3 and DAG.